Welcome, dear viewers, to the Learning Corner channel. Here in our digital space, we aim to transform complex concepts into easy-to-understand narratives, demystifying the world around us one video at a time. If this is your first time here, please consider becoming part of our ever-growing community by clicking the subscribe button. We appreciate your support in the form of likes, comments, and shares. Each interaction helps us reach more people, spreading knowledge as far as we can. Remember, knowledge is power, and it's meant to be shared, not hoarded. Don't forget to hit that bell notification button so you never miss an opportunity to learn something new. Today, we're delving into a topic that has been a part of human history for thousands of years, a disease that is as complex as it is frightening. Yes, we're talking about the insidious entity known as cancer. Stay tuned as we unravel the complexities of this multifaceted disease. Remember, the first step towards conquering a problem is understanding it. So let's dive in. Could there be a single cell in your body right now, plotting a rebellion? A tiny, solitary renegade cell that could trigger an uprising within your biological framework? A cell that, if left unchecked, could instigate a disease that has been a part of human history for thousands of years? Yes, you guessed it right. We are talking about the insidious entity known as cancer. Cancer, to put it simply, is not a single entity, but rather a dubious consortium of diseases. In reality, it is a group of more than 100 distinct diseases, each with its own unique characteristics and signature. Each of these diseases is defined by the relentless, uncontrolled growth and spread of cells that have deviated from their normal state. Cells that have lost their way, purpose, and have instead turned against the very organism they were designed to serve. The abnormal proliferation of these cells often leads to the creation of a mass, a lump, a visible sign of the silent turmoil within, a formation that we commonly refer to as a tumor. A tumor, however, is not always synonymous with cancer. In fact, we need to distinguish between two types, the benign and the malignant. Benign tumors are the harmless ones. They are the quiet rebels that never step out of line. They grow, yes, but they respect the boundaries that have been set for them. They do not invade surrounding tissue or spread to other parts of the body. They are, for lack of a better term, the good guys in the world of tumors. On the other hand, the malignant ones are the villains. They are the rogue cells that have gone astray, multiplying uncontrollably, invading surrounding tissues and even metastasizing to other parts of the body. These are the dangerous rebels, the ones that can pose a real threat to life. In our continuous quest for understanding these diseases, it is essential to keep in mind that not all tumors are cancerous. Those that are not are referred to as benign, while the dangerous ones are malignant. The first type of cancer we delve into is lung cancer. Hailed as the most virulent of all, lung cancer represents a significant global health burden, being the leading cause of cancer deaths worldwide. The sheer magnitude of its lethal potential is to send chills down the spine, making it the most critical of all cancer types to understand and counteract. But what exactly triggers this deadly disease? The answer, while multifaceted, predominantly points towards one primary culprit: smoking. Staggering statistics indicate that this perilous habit is responsible for about 85% of all lung cancer cases. The relationship between smoking and lung cancer is a grim one. Each puff of a cigarette exposes the lungs to a lethal cocktail of chemicals. Over time, these chemicals cause changes in the lung tissue that can lead to lung cancer. This mechanism, though seemingly simple, is devastatingly effective, making smoking a silent killer. Unraveling the symptoms associated with lung cancer is vital for early detection and treatment. These often manifest as a persistent cough that refuses to an unexplained chest pain that lingers and an unsettling shortness of breath. Each symptom, while seemingly benign, could herald the onset of this deadly disease, making it crucial to pay attention to these signs. With a diagnosis of lung cancer, the treatment plan often involves a multi-pronged approach. This could include invasive measures like surgery to remove the cancerous tissues, radiation therapy to kill the cancer cells, and chemotherapy to prevent the spread of the disease. Each treatment, while harsh, is essential in the fight against lung cancer. As formidable as this disease may be, prevention remains the best line of defense. It's indeed a sobering thought that the primary way to prevent lung cancer is within our control. Quit smoking and avoid secondhand smoke. Simple, yet effective. The implementation of these strategies is the best prevention. This is our fight against lung cancer. The best prevention? Quit smoking and avoid secondhand smoke. Next on the list is breast cancer. This insidious illness is a predominant health concern, as it is the most common cancer among women across the globe. It's a serious condition that demands timely attention and precise medical intervention. The exact causes of breast cancer are still largely unknown, a fact that continues to baffle scientists and medical practitioners alike. It remains an area of continuous research and in medical science, as millions of lives are at risk each year. Despite the unknown cause, certain risk factors have been identified that increase the likelihood of developing this disease. Foremost among these risk factors is age. As women grow older, the chances of developing breast cancer incrementally increase. This is an unfortunate reality, highlighting the importance of regular checkups and health monitoring as a part of aging. Next, family history plays an integral role. Women with a close relative has been affected by breast cancer are at a significantly higher risk. This underlines the influence of hereditary factors in the occurrence of the disease. Furthermore, certain gene mutations also contribute to the susceptibility towards breast cancer. These mutations, particularly in genes like BRCA1 and BRCA2, are known to dramatically raise the risk of not only breast cancer, but ovarian cancer as well. Symptoms of breast cancer often include tangible changes like a lump in the breast or underarm, a change in the size or shape of the breast, or a noticeable discharge from the nipple. Signs should not be ignored, and immediate medical consultation should be sought. Tackling breast cancer typically involves an integrated approach of diverse treatments. Surgery is often employed to remove the tumor, followed by radiation therapy to eliminate any remaining cancerous cells. Medication, particularly hormone therapy and chemotherapy, are also usually part of the treatment plan. Regular mammograms key to early detection and prevention. The importance of these annual screenings cannot be overstated, as they can significantly increase the chances of survival by detecting the cancer at its earliest stages. Through these tests, the disease can be combated before it spreads, ultimately saving lives. Now, let's turn our attention to prostate cancer, a common cancer in men, a health issue that calls for our attention due to its prevalence. This type of cancer particularly affects the prostate, a small walnut-shaped gland that produces seminal fluid in men. What makes prostate cancer particularly insidious is the fact that it's often slow-growing and may show no recognizable symptoms until it's well advanced. This trait makes it a silent threat that can go unnoticed for an extended period. In many instances, men may live with the disease for years without ever realizing it, until an unexpected diagnosis brings the reality to the forefront. The causes of prostate cancer are not entirely clear and continue to be the subject of extensive scientific research worldwide. However, a few factors have identified to increase the risk of developing this disease. Age is one such factor. The risk of prostate cancer increases significantly with age, especially after 50 years. Race is another risk factor. Studies have shown that prostate cancer is more common in certain racial and ethnic groups, with African American men having the highest risk. Family history also plays a crucial role. Having a father or brother with prostate more than doubles a man's risk of developing the disease. This link suggests a genetic component to prostate cancer, although the exact nature of this connection remains largely unexplored. Symptoms of prostate cancer can be quite varied, but may include frequent urination, especially at night, blood in the urine or semen, or erectile dysfunction. Pain or discomfort in the pelvic area, and difficulty in urination or interrupted flow of can also be warning signs. When it comes to treatment, the options can range from watchful waiting for slow-growing cancers to surgery and radiation for aggressive ones. Each strategy is chosen based on the specificities of the patient's condition, their age, overall health, and personal preference. Prevention strategies include regular screenings, such as the prostate-specific antigen (PSA) test, and maintaining a healthy diet rich in fruits, vegetables, and lean proteins. Early detection is critical in successfully combating this disease. Now let's turn our attention to prostate cancer, a common cancer in it's often slow-growing and may show no symptoms until it's well advanced. Causes are not clear, but age, race, and family history are known risk factors. Symptoms may include frequent urination, blood in urine, or erectile dysfunction. Treatment can range from watchful waiting for slow-growing cancers to surgery and radiation for aggressive ones. Prevention strategies include regular screenings and maintaining a healthy diet. Our next stop is colorectal cancer, which affects both the colon and the rectum. It's often associated with a diet low in fiber and high in fat and calories. Symptoms often include changes in bowel habits, abdominal discomfort, and unexplained weight loss. Treatment often involves surgery, radiation, and chemotherapy. Prevention includes regular screenings and a diet high in fiber. Scene script. Cancer is a complex group of diseases with many possible causes. It's a battle that humans have been fighting for thousands of years, and it's one that we will continue to fight. But remember, early detection is the best prevention. Regular checkups and screenings coupled with a healthy lifestyle can go a long way in preventing and treating this formidable foe. Until next time, stay curious, stay vigilant, and most importantly, stay healthy.